In this video, I will discuss Neisseria gonorrhoeae. So it is a gram-negative diplococcus. Gram-negative diplococcus causing sexually transmitted infection known as gonorrhea. So it causes sexually transmitted infections. It infects the mucous membranes of the genitourinary tract, rectum, and throat and eyes. In case of infants, it causes ophthalmia neonatorum. Ophthalmia neonatorum. While in case of adults, it infects genitourinary tract and rectum. Morphology. It is a kidney-shaped diplococcus and it is gram-negative. Kidney-shaped diplococcus and it is gram-negative. It is non-motile. Grows best on chocolate agar and Thayer Martin medium. How it is transmitted? Transmits through the sexual contact, either vaginal contact or anal or oral. Perinatal transmission can occur from mother to newborn during delivery, leading to ophthalmia neonatorum. This is the infection of newborn eyes. Pathogenesis. It has actually pili for the attachment to the mucosal epithelium. These pili help this bacteria in adherence to the mucosal epithelium, and IgA protease also is present in the Neisseria gonorrhoeae, and this destroys IgA antibody that is produced by the human body and present in the body secretions. So when this IgA is destroyed by this IgA protease, it helps in its virulence. Also, it is a gram-negative bacteria, so almost all gram-negative bacteria have endotoxins, and when these are released, inflammation and tissue damage occurs. Clinical features. In case of males, males have urethra, so urethritis and purulent urethral discharge and dysuria is observed. So when there is infection of urethra, it is urethritis leading to urethral discharge and dysuria. Complications. It can also cause epididymitis and prostatitis and even can lead to infertility. In females, it causes cervicitis, urethritis, vaginal discharge, and dysuria. In addition to these three things, there is cervicitis. Complications. In females, it can lead to pelvic inflammatory disease. Other than Neisseria, chlamydia can also cause pelvic inflammatory disease. It can also lead to infertility and ectopic pregnancy and also salpingitis. Salpingitis. Inflammation of the female tubes. Rectal and pharyngeal infections are possible but are not that much important. Disseminated gonococcal infection. It is actually a complication of untreated Neisseria gonorrhoeae and it leads to a triad. This triad is arthritis, tenosynovitis, and skin lesions. So when there is complication, it leads to disseminated gonococcal infection. It disseminates through the blood towards the joints leading to arthritis, then tenosynovitis and towards the skin leading to skin lesions. These are maculopapular. In case of newborns, as I have told you, it leads to ophthalmia neonatorum. It is conjunctivitis. Diagnosis. On microscopy, you will see gram-negative diplococci. These are gram-negative diplococci and remain inside the neutrophils, especially in the urethral discharge. So when you see the urethral discharge under microscope, you will see gram-negative diplococci within the neutrophils. Neutrophils are WBCs. And on culture, that is, culture is done on Thayer Martin or chocolate agar, you will diagnose these bacteria. But The most important and most sensitive test is nucleic acid amplification test, NAT. It is most sensitive and most specific. It is also done for chlamydia. Chlamydia. How will you treat this condition? Previously, ciprofloxacin was used, but now we use ceftriaxone 500 mg intramuscularly as a single dose plus azithromycin 1 gram orally as a single dose. So ceftriaxone plus azithromycin, these are used. Azithromycin not only augments the response of ceftriaxone but also helps in eradication of possible chlamydia co-infection, because chlamydia infection can also produce such features like urethritis, cervicitis, pelvic inflammatory disease. For newborn, you can use erythromycin I ointment. How can you prevent this condition? Safe sexual practices, because it is a sexually transmitted infection. Screening and treatment of the sexual partners. Neonatal eye prophylaxis using erythromycin I ointment. So this is all about Neisseria gonorrhea.